Good evening, everybody. Welcome to Med School Tutors webinar on Step 2 CK and tips for success on this exam. As everybody kind of filters into our conversation this evening, I'll go ahead and introduce myself and my co-host. My name is Dr. Joe Hansen. I've been working with Med School Tutors as an individual tutor for about 4 years now. In that time frame, I've tutored somewhere around 200 individual students for basically every exam from basic biochemistry up through Step 2 CS, which is now defunct, so up through Step 2 CK at the very least. So hopefully I can use some of that experience and leverage that to kind of help you guys to get to where you need to go on this exam this evening. My co-host, Sana, you want to go ahead and introduce yourself?
Yeah, absolutely. So my name is Sana, as Joe just mentioned. Have been with Med School Tutors now for 3 years as a member of the tutoring, involved in these webinars, doing some tutor outreach. I actually just started my radiology residency, just finished my intern year, and I'm entering radiology, and I'm at Brigham and Women's for radiology this year. And I'm excited to have the opportunity to talk to you guys about some of the tricks and tips that we've learned over our time as tutors in being successful on Step 2 CS, or CK, sorry.
Awesome. All right. So let's go ahead and jump in to let you guys know what we'll be talking about tonight. First thing we're going to go through is the logistics of the test, what the test is like, how it's administered, what to expect on exam day, and what you're going to see there. Following that, we'll talk about resource utilization, the best resources and the main resources you guys should be using, and how to divide up your work through those resources as you study for this test. And then finally, we're going to start talking a little bit more about that study process and how you would develop a schedule or strategy towards attacking this material in order to make sure that you are best prepared for exam day. All right, so just to let you know who we are before we dive into the material this evening, Med School Tutors is an individual one-to-one online tutoring company. We usually meet with students like yourself over webcam like this with one tutor and one student in order to help them with basically anything medical education related. That goes all the way from pre-med and like MCAT preparation through medical school curriculum, Step 1, Step 2, shelf exams, all the way up to residency application, tutoring and mentoring, and Step 3. So anything medical that you can think of, we generally work towards with some of the many residents, attendings, and medical students that we have on our staff, all of whom have done really, really well in these exams. I'm working towards this for about 14 years now, so we're pretty good at it. So if there's anything related to medical education you guys think that you might benefit from having a one-to-one mentor or tutor, feel free to reach out. We'll give you some of our contact information at the end of the talk tonight. So with that out of the way, let's go ahead and talk a little bit about the exam itself and talk about Step 2 CK. So Sana, do you want to go ahead and start us off by saying, why is this important in the first place?
Yeah, absolutely. So I'll preface this by saying the fact that you're at this webinar means that this is already important to you. So you probably don't need me to go into the detail of why this is so important to your residency application. But just for completeness sake, Step 1 is, of course, one of the primary things that residencies look at when deciding where, A, whether they're going to interview you, B, where they're going to rank you, as you can see in the program director survey. But Step 2 CK is not far behind. It is an extremely important exam and is only going to increase in its importance, A, as Step 1 will in 2022 turn to pass-fail, and secondly, as you know, there's more and more of an emphasis on clinical decision-making and clinical medicine, and Step 2 CK, as we'll talk about, has really a much more, a stronger focus on the clinical decision-making aspect of medicine. So very, very important to do well on. Having said that, don't freak out. The big things that are important in creating a study plan, creating the things to focus on, we're going to talk about today. But it is very important to do well on this exam. And I think we really don't want you to, think that this is just another checkbox. It is just as serious, if not increasingly more so, as Step 1.
Yeah, absolutely. I'll throw in there that unfortunately for everybody this evening, Step 1 being pass-fail won't be too relevant, if only for some of us. But it will in the future, which means that already kind of preceptors and residency application programs are going to start looking more towards Step 2 CK as kind of a marker of your success in medical school. For that matter, for you individually, Step 2 CK can be an important tool to utilize to kind of leverage over a Step 1 or Level 1 score that we're not super satisfied with. And so this is another chance to demonstrate strength on applications. A lot of programs will look at the highest score that you have between those two exams and use that as their benchmark for you when it comes to determining whether we pass the threshold for interview invites or not. That's not a universal, but it can be true in like a lot of programs. And so as a result of that, doing well in this exam can either further substantiate your success on standardized exams that you've had in step one, or it can help you to kind of get over the hump and gain the possibility of earning an interview at a program that otherwise might not have taken such a strong look at your application based on step one performance. So it's an important exam, to say the least, and I'm sure you're all aware of that. Now, as far as the exam layout, step two is very similar to step one, except a little bit longer. So for those of you who have taken step one already, which I presume it was most of you, but that's okay if you haven't, step two is a 9-hour exam. You're gonna have 8 blocks of questions, and each block is gonna have around 40 questions in there. Generally speaking, it's a maximum of 40 questions per block. They could have slightly fewer, 39, 38, 37 per block. As a result, the total number of questions that can show up on the exam is 318 maximum. So it's not an even division of 40, obviously, because some blocks will have slightly fewer questions. That being said, they're all 1 hour in duration. So you have 8 solid hours of testing and 45 minutes of break time, plus a 15-minute orientation block. Now, that 15 minutes of tutorial orientation is important because that's where you check your headphones and you make sure they work, which I encourage you to do. But otherwise, you can actually go to the USMLE website and see the tutorial before you go into the test. And if you skip it, you get to add those 15 minutes back to your break time. So in reality, we have nearly an hour of break and nearly 8 hours of questions to do. In total, that gives us a 9-hour day. So it is a really long day. And one thing that we're going to talk about is how we start to build that stamina to get to the point where we're capable of actually completing that entire exam without totally losing energy and running out of stamina. Sana, anything to add about just the exam layout itself?
Yeah, I think you hit on the major points. The only thing I just really want to reinforce is that one of the things I was surprised about when I went into the exam is just how much that extra time really wears you down. And so that stamina, again, we'll talk about it, but really it is a longer exam and it is an exhausting day. So really it's going to be important to practice and to build up to get ready to take it.
One more thing I'll add that I almost forgot to mention here is that although there are 8 blocks of questions on here, in reality, only 6 of them are really worth grading. So presumptively somewhere around 80 questions on the exam, likely disseminated throughout the exam, not 2 full blocks, but 80 questions on the exam will be experimental and non-graded, which means that as you're going through the exam, if you do run into any questions that really frustrate you, you can kind of like help protect your ego a little bit and say, that was an experimental question, that one didn't count. So while it's a long exam, you are allowed to kind of stumble and trip along the way, and you can still do superlatively on the exam. So I want to point out that not every question on there is graded. There's pretty good indication that about 80 out of those questions, or 2 full blocks worth, are going to be experimental questions. So on that note, Sana, can you talk a little bit about how the exam is broken down, like what components we have to focus on there?
Yeah, absolutely. So this is all information that's available on the NBME website that they put out there for everyone to sort of get a sense of what is actually being tested. And so, you know, we have really 5 categories here. The big ones that I want to stress, medical knowledge, so foundational concepts, right? So this is going to be a lot of what's similar to your step 1 knowledge. So do you understand diagnoses? What are the differentials? What are the big topics in basic science that can be applied to step 2 topics? And that's 12 to 16% of the entire test. And then you have patient care. So that's like a lot of primary care information. So health maintenance, when are you supposed to get vaccines? What is this typical screening guidelines? And so a lot of that's 7 to 11%. And then of course, there's a lot of communications. You'll find that there's I felt a stronger emphasis on ethics questions of complicated patient interactions and what you do in this scenario. 3 to 7%, still not a huge number by any means, but those are tested. And all in all, that still will add up to a good 40% of your exam. So not to be taken lightly and not to be ignored, because some of those bigger topics can be a little easier to overlook in your studying and preparation. And then of course, you know, these are the other 2 big areas which we focus on, you know, most of our studying is the actual diagnosis and management. So that will be your classic patient comes in with, you know, epigastric pain radiating to the back, right? That's like your classic presentation. That's just how do you diagnose it? And then how do you treat it? That is still going to be the majority of the exam, that 40 to 50 and then 22 to 27%. But again, I would stress that should be probably where the bulk of your studying is, but not to ignore those other topics because that is still pretty heavily tested on the step 2 exam. Anything to add on that, Joe?
I'll simply echo that in particular, the communications and maybe something like
Yeah.
biostats type questions, which end up
Hmm.
representing a small portion of the exam, are nevertheless going to be focused on a very small number of topics as well, meaning that they're probably going to ask a certain small number of biostats questions. But if there's only 10 or 12 different types of questions in biostats, meaning like relative risk, a cohort study, or bias type questions, you have very little to study in order to cover the entire breadth of that small field. So while it might seem like, well, I got to know a lot about diagnostic studies because that's a huge portion of this test, there's also tons of diagnostic studies to study about. And so as a result, your individual time spent there is probably lower yield than time that would be spent mastering a very small category. There are only so many different types of communication or professionalism style questions that show up on the exam currently.
Right.
There's only a small number of biostat style questions. And so as a result, focusing on those small territories actually does have a pretty abundant yield for most students. And so we would strongly encourage not to ignore smaller categories merely based on their numerical representation here. That being said, on the flip side there, if we're looking at the breakdown of the exam when it comes to the actual disciplines on there, medicine takes the cake here. It is over half the exam. The other major disciplines, surgery, peds, OBGYN, and psych, all add up to basically match that. In this, we would say medicine matters a lot. We should spend a lot of time emphasizing our learning in medicine. That should not be underlooked. That being said, psych will represent about 10% of most exams. And so as a result, we should be paying attention to that too. But you'll see that UWorld does a relatively good job of breaking down the disciplines for you as well. If you look at the relative distribution of questions in UWorld for Step 2 CK, over half of them are represented by medicine, and around a quarter of them are in surgery, a quarter of them in peds, and slightly fewer in OBGYN, with much fewer in psychiatry. It mirrors the breakdown of the actual exam. So we don't have to spend too long thinking about how we're going to apportion our time because our main question bank does it for us, and that will help to determine for us how we're going to end up parsing our time on the actual exam. Anything else to say about this before we move on, Sana?
No, I think you got it.
Cool. All right, then let's kind of talk about the similarities and differences between Step 1 and Step 2, just because they seem like they're identical. So, Sana, I'll let you go first here.
Absolutely. And we actually got a great question just about this as well, which is sort of along the same lines of how do you know where to draw the line between studying for Step 2 and going back to the Step 1 content versus going too far in detail of the Step 1 content. And I think what I'll say is you have to know the basic pathophys of every disease. So I want you to really understand if someone has a heart attack 5 days after, what complications and what drives those complications. Understand like what actual molecules and what actual cell mediators are driving the disease. So the big picture things. Having said that, forget the Krebs cycle, forget everything about biochem that you ever learned, with a grain of salt. But like, you don't need to focus on those things. I think focusing on the big diseases, the big processes in all of the organ systems is really what's important to focus your energy on, because that's what's going to be tested. And that is the same. How do you diagnose? How do you treat? I would say a lot more focus on Step 1 was identifying the diagnosis. I know Step 1 does have significant second and third order questions. Step 2 has even more. So I think that really understanding, differentials and then the best choice in moving forward. And that really comes from clinical experience and understanding what do I actually order first, is more of the flavor of Step 2. And then, of course, as you know, you're going to use imaging, you're going to use physical exam, you're going to use labs. I will say I feel like there was not as much histology. So histology was pretty heavily tested on Step 1 because it is much more of the foundational science. Step 2 is less focused on that. You'll see a lot more of like the image. You will still see lots of scans, CAT scan or abdominal CAT scans, etc. And then what I'll also say is UWorld, still the best learning tool. That has not changed. That should still be your number one resource for Step 2, which we'll talk about a little bit later in terms of resources. Still, you have the NBMEs available online. But again, you're going to be using a lot of the same resources, but there's a little bit more of a focus on, how do you work this up next? Not to say there aren't, what is this diagnosis, but I think there's more of a shift in focus. Anything to add on that, Joe?
I would simply say that, just to echo your point, that there are going to be questions that will say, what is the diagnosis here? But going back to how do you eschew the basic sciences from your study process and like where the line is between those things, My favorite example to use with students is you might see that there's a case with a woman coming in with hyperemesis gravidarum, and they say there's ketones in her urine. We need to know that ketones represent fat breakdown and the lack of gluconeogenesis and therefore starvation. That's important clinically, and that helps us to identify that she's in hyperemesis and not merely experiencing aggressive morning sickness, for instance. That would be a distinguishing factor. However, they're not going to give you any questions where they say which one of these are important in the process of gluconeogenesis and put like alanine or some other structure like that on there. There's not going to be any basic biochemistry on this exam. However, the kind of tenets of biochemistry still do kind of apply when we talk about metabolism. So do not know the TCA cycle, but know why we produce a ketone body, for instance, would be the difference between step 1 and step 2. You may still get a question that says, what is the diagnosis, hyperemesis gravidarum? But you will also have more questions on step 2 than on step 1 that will say, what do I do next for this woman who's coming in with hyperemesis gravidarum, for instance? But very well said. So excellent job, like walking through the distinguishing factors between step 1 and step 2. I will say that there are going to be some differences when it comes to preparing for step 2 in terms of the resources and strategies that you'll use. So one thing that's kind of nice about step 1 is that you can see everything in first aid and UWorld. Step 2 CK, it's a little bit harder to kind of identify which resources we're supposed to use, because now we've added in like online med ed, and maybe we're using some case files over here, maybe I use Pistanas over here, and step up to medicine and first aid, and there's a bunch of different competing resources now, and kind of isolating and identifying which are more useful is difficult, but we're going to try to help you with that a little bit, so don't stress out too much. Otherwise, though, in terms of like deciding how to prepare for step 2 CK, step 1, usually students will sit down and say, I know that I need like 6 weeks of dedicated study or as much time as I can scramble together. Step 2 CK, especially these days, maybe not so easy to like grab onto a big chunk of time for dedicated study. Ideally, we'll take the time that we need, which we'll talk about more going forward, but it's definitely recognized on the part of like us and like other people who are going to help you through this process that your time is going to be more sparse and more difficult to collect into one big time frame. And also taking the exam might prove difficult just given test center closures and now how your clinical rotations might have shaken out after everybody went home from the hospital for a little bit. So we're going to have to develop new skills in terms of like how to learn this stuff rather than sitting down and studying for 12 hours per day. We might have to layer this on top of doing an elective rotation or a sub-I in some cases. It's worth pointing out that step 2 CK is probably impossible to cover all the material multiple times before you sit down and take the exam, especially with the timeline that we have until ERAS eventually opens up. So if you were one of the students who had like multiple passes through step 1 material, we might have to pull back on that kind of strategy or thinking where we're thinking about step 2 CK, where getting through what we can and leaning on the areas that we're weaker on to study more is going to be the kind of stronger strategy, more efficient strategy, more doable with the limitations and time that you have left. Speaking more on step 2 in terms of like its overall kind of layout, we talked about this a little bit, but Sana, do you want to just like detail a little bit more what type of questions we end up seeing on here?
Yeah, absolutely. So as we were mentioning, we sort of alluded to this, but what you should be expecting to see as far as the questions, one of the most common ones is what's the next best step? So you have a patient comes in, certain presentation, gives you an idea of what the presentation might be, and then, okay, what's the next thing I'm going to do? Do I need to scan them? Do I need to get a biopsy? Do I need a consultant? Do I need to go to surgery? And really working through, do I have enough for a diagnosis? And if I have enough for a diagnosis, do I treat, and what is the mechanism of treatment? So really figuring out, and it is more just like clinical judgment. So it's far less focus on identifying the patterns and identifying more features of the disease and more thinking about what you do clinically. So that's one possibility. Another is the best diagnostic tool. So sometimes that will be one form of imaging versus another form of imaging versus a biopsy versus, you know, any number of things. And so figuring out, and that's just a matter of studying the different diseases and studying what works best for all of those different diseases. And then of course, as we mentioned, there is still a component of what's the most likely diagnosis that will happen. I will say it's in decreased proportion, as we've alluded to before. And then complications are another one. So again, what I was talking about before with the heart attacks, right? 5 days after, what do you expect to see? Versus, you know, if you have this type of surgery, 3 days after, what do you expect to see? Or what is the most common complication of that? Risk factors. So this is a common one seen in primary care outpatient questions. So if you have a patient who comes in with, diabetes, hypertension, and a number of different issues. And they'll say, which of the following is the most likely risk factor for their development of some other disease? And just figuring out what is important. And that comes from a lot of practice and seeing it in the outpatient setting as well. And then there is still basic science. So as much as we said you should focus less on the pharmacology, biochemistry, et cetera, it is still there. So like Joe was saying, really understanding the basic pathophysiology is essential no matter what, and will just, period, make you a better doctor. But I think also really making sure you do still understand how an ACE inhibitor works and understand what is a beta blocker actually doing. Those things are A, going to make you a better doctor, but B, they are still tested. So wouldn't put those completely to rest quite yet.
Yeah, and I'll kind of echo that a little bit more too and say that, calculating a clearance is probably not going to be so much on step 2 CK, but you are probably still going to get questions on the actual mechanism of like what you would see in a nephritic syndrome. So the kind of like histological findings that would show up for maybe membranous nephropathy or something like that might actually show up on this exam. So basic pathophys does show up, but it's more along the lines of understanding like what happens to the compliance of the heart in this case, or what happens to our pulmonary function tests in this other case. And so while we can't totally forget everything we learned in step 1, some of the more nitty gritty stuff from like biochem and immunology and microbiology does kind of fall away in preference for more questions that are asked about next diagnostic and next management step that we're going to see there. So we're going to transition to talk about the resources that we utilize to prepare for this now. Before we do, there's actually a really good question that somebody sent about the experimental questions. I mentioned this on a previous slide, so I should come back and talk about this really quickly. There was initially an announcement by the USMLE that they would remove experimental questions from step 2 CK and step 1, which amounted to removing 80 questions from the exam. That would mean that we'd go from around 320 questions down to a total of about 240, all of which would be graded, meaning that there were no like questions that didn't matter on the test anymore. That was only going to be for a select number of locations. That was never going to be for a test administered in a Prometric center. And then they changed their mind about that due to backlash. So you will still get the same full test that everybody's always gotten. There is no change to that. There are still experimental questions as of right now on step 1 and step 2 CK. Who knows what tomorrow will bring, but there have not been any announcements as of 5 minutes before this presentation that stated otherwise. So you still will have experimental questions on there. You still do have a full 8 blocks of question exam on there. So thanks for bringing that up though. That's actually really important. So good question. Keep those questions coming, by the way, if you have them. We'll try to weave them in as we go here. So diving into our resources and talking about what we'll use here. The best and most important primary resources that we have to use fundamentally includes UWorld. We have to use UWorld. It is the best resource we have. We need a foundational question bank to work from. A lot of students ask questions about using alternative question banks or supplementary question banks. I have to point out that if you are preparing for step 2 CK at this point, I would be very impressed to hear that you've done more than 1 full pass of UWorld at this point. Our strongest recommendation is to complete at least 2 full passes through UWorld before you even consider using another question bank. And I'll further emphasize that most students can achieve their best possible score on the exam by completing 2 full passes through UWorld. So please don't read into that statement as you need to do more than 2 full passes of UWorld, because you do not. You just need to do as much UWorld as you can. If that means getting through a full pass or 1.5 passes before you take your exam, that's totally fine. But what I'm saying is we basically cap out in terms of efficiency when we've seen UWorld as best as we can. And the peak performance that we can get would be by seeing everything twice to consolidate the material that we learned from it. So can we use other question banks like AMBOSS, which is my personal second favorite nowadays? Yes, they can be used supplementarily, but you can't necessarily incorporate that and try to complete all of the questions in AMBOSS and all the questions in UWorld without a surfeit of time. So most likely, most students will only need to use UWorld. And I can promise you, you can do very, very well in step 2 CK without using an alternative question bank. So outside of rare individual circumstances, you should probably make it your goal to use UWorld as your primary question bank. That's a pretty strong recommendation on our end. In addition to that, it's nice to have some core resources to utilize in terms of like something to read that covers all the material. We're pretty big fans of Step Up to Medicine and or Master the Boards nowadays. Unfortunately, IM Essentials is kind of becoming defunct at this point, so that one's probably off to the wayside. But Step Up to Medicine and Master the Boards are good overall resources that cover everything in kind of a thin amount of depth. So we don't get all the information from those texts, but they're useful to kind of supplement what we're seeing while we're looking through UWorld. So our fundamental recommendation here is when you're arming yourself with resources and deciding what to use, whether for a dedicated study period or alongside your kind of like rotations while you're preparing for the exam, is one big question bank, UWorld, and choose one overall reading resource like Step Up to Medicine or Master the Boards. Personally, I find that Step Up to Medicine is a little bit more detailed. Master the Boards is a little bit more for getting the core concepts down. It's a little bit less depth than Step Up to Medicine. Pick your poison depending on what you find that works best for you if you've happened to see both of them. If you want the more rigorous resources, probably Step Up to Medicine. Anything to add about those resources?
Yeah, I'll just echo exactly sort of that distinction between Step Up and Master the Boards. I found that I personally did not use either of them, but many of my students have used either Step Up or Master the Boards. And what I've heard across the board, Step Up to Medicine is really, really great for your clerkships because it's much more detailed. It has a lot more of like the random trials in cardiology that some of the cardiologists like to talk about, and a little bit more detail than you would need on the USMLE exam, but would be great for your actual clinical rotations, versus Master's Boards is exactly as stated, a little bit more boards focused. So it has more of an overview, is more of the general broad strokes. Not to say it's not a great resource. It has a lot of great information, but a little less nitty gritty as far as the details. And one person has mentioned in the chat, as you have correctly noticed, first aid for step 2 is really not as great of a resource as it was for step 1. Some people still love it. Some people still really like to use it as sort of the foundational, but to sort of transition, it's not really as, essential for a primary resource. So that slide was our mandatory, we really think you should use. These are more supplementary. So the USMLE step 2, it's great and it has like broad strokes, but I don't necessarily know that I would say that you necessarily need to use it. Pestana is really great for some of the surgical topics, but again, it's a pretty short book. And so this is not necessarily something I would say you should be using as your primary source for the actual clerkships itself, but can be very useful to give you broad strokes for the actual surgical resource. Amboss, as Joe mentioned, Sketchy is always great. I'm a big Sketchy fan personally. So highly recommend that resource. And then OME, I've heard very mixed things about OME personally. I used it. I did not love it. Some of my students find it to be a great foundation. What I'll say is it is not enough. It is by no means enough. It can give you a little bit of sort of a template for studying, and give you some sort of like video resource if you like the video style learning. But I will say in general, it's not nearly in depth enough to give you a good foundation for the board exams. Any additional thoughts on these resources, Joe?
Yeah, definitely. I'll add on to online med ed. It is not sufficient to do that alone and go and take the test, of course. Yeah. I do like it for this purpose, though. I recommend it to a lot of students that I work with because it acts as a kind of a nice glue to kind of stick together the readings and the UWorld questions, meaning that if you're doing UWorld questions in a specific topic and you see the online med ed videos, then it becomes more easy to recognize what matters from those online med ed videos and gives you a little bit of recall. So you can say, oh, I remember getting that question wrong about a myocardial infarction or something along those lines. And now he's talking about it in the online med ed videos. They're a little dry. They're not the most entertaining thing in the world, but they are pretty good at acting as a passive resource that students can use alongside the more active resource that they're using with UWorld and like primary text that they're reading. So I think that there's utility in it, but at the same time, we got to recognize that it's kind of like a filler to put into your daily schedule rather than something that necessarily is going to be groundbreaking or foundational to the learning, which is why we kind of put it on the supplemental resources there. I'll add on that some of these supplementary resources do not need to be touched at all. Right. I want to point out that we're not suggesting that you guys have to use all of these supplementary resources to some degree. Yeah. In fact, most of the students I work with, I suggest that we completely eschew the utilization of first aid for step 2 CK, except for maybe just like a reference resource in a couple subjects. No need for an extra question bank in Amboss. No necessity to using Sketchy here. I'd point out that it'd be really difficult to incorporate even the step 2 CK sketchy material, like sketchy IM, for instance, if we're already doing a read through Step Up to Medicine or Step Up to Step 2 CK or Master the Boards, or if we're already utilizing all of UWorld and online med ed videos. This is kind of a la carte option for you guys to kind of consider what resources other people might use in portion, but not in total. Trying to complete all of these would be impossible. That is not the goal. But one thing I do suggest for my students is maybe instead of focusing on surgery and master the boards, let's go back and look at Pistana instead. So you can kind of weave these things in and replace components of what you would otherwise be doing as you're studying for this material. So I do want to emphasize there are other things that we might like weave into here as well. A couple of students have asked about like, what about first aid for step 1? Is that still useful? For biostats, yes. Biostats on step 1 and step 2 CK is nearly identical, apart from a couple of small additions they make in step 2 CK. So we'll talk about this later too, but we do like to incorporate first aid for step 1 for that in particular. So there are other things that we might pull in for this and that, but overall, utilizing the main resources we discussed and then kind of piecing together some of these secondary resources usually creates a very robust strategy. But again, attempting to use all of these things would be far too much. And I'll throw in my 2 cents on Anki. Anki is kind of useful for step 1. A lot of people are using it these days, maybe overutilizing it a little bit. It's great for direct discrete memorization, and of which there's a lot in microbiology and basic pharmacology. But on step 2 CK, there's not nearly as much of that. Now, there is some pharmacology, so it might be useful to take a look at sketchy pharm in areas that you feel weak in, but using Anki cards on a daily basis is not a total necessity for step 2 CK. It depends on how you learn best, and everybody should start taking stock of what works for you and what fundamentally doesn't work for you. But if you're finding that you're putting a lot of time into flashcards for step 2 CK preparation, and it doesn't feel good, you're not really getting a lot out of it, you can definitely pull back on that. So again, these would be resources that maybe we touch on for like 30 minutes a day, maybe an hour per day maximum, on top of like the several hours we'd be spending in UWorld and doing other readings. Anything to add on to that, Sana, before we move on from the supplementary?
No,
resources?
I think we beat that one to death.
Cool. All right. Yeah. So let's just talk about how we integrate these things a little bit. So we'll talk more about study schedule creation in just a moment. But in terms of like how to piece these materials together, I would suggest that you organize your day if you're spending a full day studying. This is presuming like a dedicated study period or a weekend, by mainly working on UWorld. The questions should form the foundation of your strategy in preparing for this test. Your goal should be to see all of the questions in UWorld in fairly rapid sequence before you sit down and take step 2 CK. So if you can stomach sitting down for getting like a full 2 blocks of UWorld done per day on a dedicated study day, like 80 questions, that would be the main goal. If you move at a pace of about 10 questions per hour, which is a pretty reasonable pace, that's like 8 hours of work right there. Add on like another hour for reading from a primary text. So a chapter in like Step Up to Medicine, or maybe looking at like the, Pistanas as your surgery text if you're doing surgery that day. And then maybe like 30 minutes or an hour for looking at some other resource like online med ed videos, or maybe going back to Sketchy for a particular subtopic that you really felt weak in the material you're working on. That adds up to a pretty solid 10, 11 hour day of study. And that would be your perfect ideal kind of like full study day. Mainly questions, some reading, fill in with some ancillary resources as you're making your way through your day. I'll point out too, that the reason we want to organize our day like this is that we are going to strongly advocate for a kind of systems-based review, even for step 2 CK preparation. What I mean by that is you should probably focus on doing all of surgery together, all of OBGYN together, all of peds, all of psych, so that you can really master those materials, watch their online med ed videos, and read their chapters in like Step Up to Step 2 CK or Master the Boards, so that you get everything in a layered fashion. You're making sure that you've totally understood everything in one subject before you move on to the next. And within medicine, I usually strongly suggest my students literally move through every subspecialty of medicine one at a time. So spend an entire day, or a couple days probably, on cardiology, a day or two on pulmonology, a day or two on nephrology. So each individual specialty in medicine is worth dedicating some focused time to. For the other subjects like surgery, OBGYN, it's not as easy to subdivide into like cardiovascular surgery or really anything in OBGYN outside of reproductive stuff. So as a result, you should just focus on them as big subjects. So treat like surgery as a really big system or specialty, just like you're treating cardiology medicine as its own specialty would be my suggestion there. Anything to add about like the daily workflow, Sana?
Yeah, we just got a few questions about sort of what the timing should be regarding reviewing these blocks, doing these blocks, and how to really use that time to review them, which I thought I would just touch upon. Really, I think the UWorld blocks should take, I think, longer than you take to do them. So 40 question block takes you about an hour to get through. Typically, most of my students spend between 2 to maybe 3 hours reviewing all of the questions. Sometimes for step one, they would spend up to 4 hours, which I don't think those are necessarily as important as it was for step one. But I think most of these blocks you can get to in 2 to 3 hours after you actually take the block. And then as far as the best way to review the blocks, it can be challenging. I think that the tough thing that I always told my students for step one is annotate everything into first aid, use first aid as your Bible, and use UWorld to sort of flip back and go through. And so for this, what I generally tend to say is, once you see a question, it should take you a little bit longer, because you can either if you want to use Step Up or Master the Boards, whatever you choose, you can use that as your first aid for step two. But what I would additionally do is I would just go back exactly as Joe was saying, like, okay, I really don't know anything about this particular surgery. Let me go back into Castanas and like read for 10 minutes about what this surgery is, what the indications are, what the sort of like algorithm is for working through this. And really going through and reviewing that way can be useful. But it is challenging, and some people like to make like a OneNote notebook and like go through all their questions there. So it really depends on what you do. And I would spend, the first week of studying really figuring out what your method is, and figuring out what your process is, because it's going to vary for everybody.
Couple more questions have come in as well.
Yeah.
A lot of people asking not just the duration, but like how to learn the most we can from the actual UWorld questions as you're reviewing them, and a couple of questions about note taking in particular. So I'll jump into that real quick. When you're going through UWorld, my main suggestion for note taking and for learning as much as you can and kind of harvesting the material is to read the explanations thoroughly as you're doing these questions. You should plan, especially in your first pass, to read every explanation all the way through. If you make it to a second pass, maybe we can expedite the reading through the questions you get correct, but you're still thoroughly reading explanations for questions that we missed or questions that we guessed correctly on. When you do so, my strong suggestion is that you try to formulate and distill the one key idea from that question that you think you need to know in order to answer correctly. That doesn't always mean it's the educational objective at the bottom of the question. Sometimes it's something that you just simply didn't know. My favorite example of this is that digoxin stimulates vagal nerve and causes slowing heart rate when you use it, because nobody really thinks about that with digoxin. They think of it as a contractility agent. So if that was the reason you got the question wrong, even if it wasn't the educational objective, you just didn't know that key fact, that would be the thing that I would want to write down as a note. My suggestion here is one key idea, less than one sentence, that you write down for each note as you go through the questions in some kind of UWorld journal, whether that's a Word document, an Excel sheet, some kind of Google document, or just scratch paper, or a spiral notebook that you're writing it in. Wherever you want to write it, that part doesn't matter, the format. But what does matter is writing one key idea per question that you miss in order to make sure that you remember that fact for later. The idea would be then to go back and review those facts at the end of the day for about 10 minutes, just to say like, oh yeah, I remember getting that one wrong. That was silly. Or, oh, okay, now I'll know this for next time. And then each week, looking back at all the notes that you took for that week and say, okay, yeah, like I remember all of these, that's familiar. I remember what I've learned from this week, and then repeat the process each individual week. If you do that, less than one sentence for each question you miss, and you do relatively well in UWorld, and you get about 2/3 of the questions right in there, that means of the 3,000 questions in UWorld, you're still missing 1,000, and you're writing down 1,000 facts. That's already really hard to review if you're writing down one key idea, less than one sentence for every question you miss. If you try to write more than that, if your note taking is more robust than that, you are going to have a mountain of information that you'll never be able to parse, and it's going to be impossible to review those notes. So my suggestion is the smaller the better when it comes to note taking. Read everything in the explanations, write down only a very tiny bit, and that way we can hopefully get as much as we can. But also keep in mind, you're not supposed to learn everything from UWorld, meaning that you cannot memorize every explanation or the entire Q bank. There will be things that slip through your fingers, as happens with everybody. Going for pure explicit memorization of every resource you're using is too high a standard, and you have to allow yourself to move on. So for a couple of students who have mentioned, it's taking me a long time to get through UWorld questions. You should allow yourself to move forward and leave some information behind making sure that you get the core concepts from those questions. Anything else on it that other people had asked while I was going through that?
No, I think that was great.
Cool. Okay, so let's take a step back then and think about how are we going to know when we're ready to take the test, or how do we know if we're making progress? So Sana, do you want to run through how do we utilize practice assessments?
Absolutely. And so this is actually very familiar to many of you because a lot of what you do in studying and figuring out your progress in step 2 is very similar to exactly what you did for step 1. So you have the NBME shelf exams, which most of my students throughout third year, and I'm assuming, and this could be incorrect, most of you may be taking this at the end of third year, at the beginning of third year, just depends. But most of my students take the shelf exams, the NBME shelf exams throughout the year as they're completing their clerkships, as they are preparing for their shelves. So that gives you a sense of how you're doing in each of the individual topics, how you're doing in psych, how you're doing in surgery, how you're doing in OB, etc. And then once you're actually in that more quasi-dedicated period, because as we mentioned, it's not really as clear-cut 6 weeks as you had for step 1, you should spend more time doing the NBME and UWorld practice assessments. These ones I've actually found across the board are very, very good. The UWorld ones, especially, for whatever reason, UWorld always comes up with really excellent self-assessments for step 1 and step 2. But I really think that using those, one as a benchmark when you perhaps begin your studying, and then I typically recommend 2 to 3 of them. If you have a lot of time, then go nuts. But really using those to mark your progress. And I think the other question is that, a lot of people are asking, how much time should I actually be using? Especially we have DO students, we have foreign medical graduate students who all are coming from sort of different backgrounds as far as their preparation before the exam. And so typically, and this is really just my personal experience with my students, typically I'll say that you should, if you are not coming straight out of third year of medical school, I'll tend to tell people 3 to 4 weeks at sort of a starting point. And, that'll depend based on where you're starting off, what your practice exams say is a good sort of idea of how long you'll need to study. Any additional thoughts on that, Joe?
I'm just really happy that you said that you really like the UWorld self-assessments because they are by far my favorite tests for step 1 and step 2 CK at this point. I will throw out there that I've soured a little bit personally as an individual tutor when I have students take the NBME CCS essays, the NBME 6, 7,
Sure.
and 8, just because the average scores on those tests are absurdly high. To get a really, really strong score on those, you need a raw percentage of really, really astronomical numbers in order to get an above average score. And so the curve is very skewed on those tests. And so it can end up discouraging a lot of students who end up getting scores that don't quite represent where they want to be. And so I strongly encourage students definitely utilize UWorld self-assessments, at least one of them close to your exam date, to give a realistic picture of what your score might look like on the real step 2 CK exam. The CCSAs are nice for what they are, but I consider those to be kind of like a normal, 13-mile jog, as opposed to like UWorld self-assessments being like a time trial half marathon preparing for like the actual marathon. So that's my personal preference on those, but I think that that's one of the consensus I see popping up among the tutors is that UWorld self-assessments are very, very good resources. You should use them anyway because they're new questions with new explanations. So I would really strongly encourage you to utilize those, but also at least utilize one of them close to your exam date so you have a good sense of where you're at. Before I move on, there's a question about what order to do the NBME exams in. Don't take NBME 7 first. That'd be my suggestion. That one tends to be the hardest one in terms of the difficult curvature that they put on the NBME CCS essays. And so if you take that one first, that's going to establish a very low baseline, and that's also going to make you feel kind of bad. So just that's kind of subjectively, anecdotally, like what people have said about the NBME 7. Otherwise, taking NBME 6 or 8 doesn't really particularly matter. As long as you take one of the UWorld self-assessments towards the end of the study period, that's my main recommendation. Otherwise, the order is not too substantial. Okay, so let's go ahead and move forward to talk about individual resources for each individual subject. So this is going to get a little detailed, but we're going to talk about which resources are best for each subject that shows up on the exam and how we might tailor our utilization of resources towards those subjects as we're working on them. For a couple of students who have asked questions about shelf exams in particular and how to prepare for those, this really represents that as well. One thing to keep in mind is that For those of you who have not completed all of your core shelf exams at this point, core shelf exams build up together to form Step 2 CK. So if we do well in the shelf exams, it stands to reason we're prepared to do well on Step 2 CK. If there are any that we had difficulty with, then we should probably focus on those territories as we're preparing for Step 2 CK in order to kind of supplement our weaknesses. So I'll start out with internal medicine here and say that this is the majority of what's on the exam, the majority of the questions in UWorld. This is where you'll be spending a lot of your time. We mentioned Step Up to Medicine as a major core resource here because medicine is so fundamental to this test that using Step Up to Medicine is really important. You can, of course, use Step Up to Step 2 CK instead and use the medicine chapters in there. They're pretty identical in terms of what they present. Step Up to Medicine is a little bit more detailed in some territories. It's entirely up to your preference. There's no one right answer to Step Up to Medicine versus Step Up to Step 2 CK. In addition to that, personally find that online meta videos are pretty robust for these. There's a lot of them available, so we can use those as supplementary resources as well. And then pretty much everything in here is valuable when it comes to like the questions in UWorld. Like there is no one area that really stands out. I will point out though that even in internal medicine, cardiology has more questions than pretty much anything else. Probably worth investing a good amount of time to understand the various facets that are in there. Whereas rheumatology, once again, gets kind of the short end of the stick. And so as a result, there's probably fewer questions that are going to be focused on that material in particular. Anything to add about internal medicine, Sana?
Yeah, I think the only thing I would add that we neglected to mention before is that a lot of these are these textbook resources, which are great. And then we mentioned that Anki is available. We at Med School Tutors, we have our own Anki decks that we provide for IM and for Step 2 more broadly. But the IM and Step 2 ones both are really robust and cover sort of everything. So depending on what your actual resource that you use the best, that you learn the best from, whether that be questions like UWorld, which you should use no matter what, textbooks, or actual Anki decks. What we have is, sorry, I misspoke earlier, the Memorang decks, which is a very similar flashcard concept that MST uses and that we provide to all of our students for free, is a really great resource if flashcards is your technique of choice.
Awesome. Thanks for throwing that in. And I'll agree that, especially for shelf exam preparation too, like having a flashcard resource can be pretty useful there. But again, learn how you learn and identify what works best for you. If flashcards are a tool that work best for you, some of the memory index that we have are pretty good. At the same time though, don't overemphasize. A lot of students have a temptation to try to use flashcards like 4 hours per day when they're studying for Step 1. Yes. It terrifies me a little bit when I hear that. I don't know how they manage that. But there are more efficient ways to learn that includes using each resource appropriately for the appropriate amount of time that we should emphasize there. Moving on to talk about surgery. Surgery is one of the kind of like fundamental blocks of the exam. About a quarter of the exam is going to be surgery. I'll throw out that, of course, UWorld is always useful here. I really do like using Pistana as a supplementary resource and basically saying instead of trying to read like Master of the Boards or Step Up to Step 2 CK and some kind of like trauma or surgery related chapter, just replace your reading with some of the Pistana chapters instead. It's a really nice book that just like boils everything down to like one key idea. So basically everything in that book is just like answer to a UWorld question, answer to a UWorld question, just like written in sentence form, which is really nice. And so it's a nice way to kind of boil everything down for surgery. I find it to be the most efficient resource, but of course, it's not very fleshed out. It's a tiny text. And so as a result, you do need to utilize other things alongside that, namely online meta videos, definitely UWorld questions as well. You could also like layer in like using first aid for Step 2 CK in this particular case to kind of like go through some of the protocols and flowcharts that we have for trauma management. So something to kind of add in there potentially from like the first aid text. But again, if we're doing that, then we're probably leaning away from utilizing other resources like Pistanas. Pick your poison, choose what works best for you. There's no one correct answer to this stuff, but this is the one that typically I'll recommend to students who don't have a particularly strong backing in surgery. All right, so Sana, I'm going to ask you about pediatrics next.
Yeah, absolutely.
What should we use to prepare for that one?
Yeah, so peds is a very different sort of thing to study for. It's sort of a little bit similar to IM because there's a significant outpatient component to pediatric studying as well as a significant inpatient component. So really trying to make sure you cover both of those is going to be essential. The best book resource that I would recommend would be either Master the Boards or Blueprints. Those are really the best for actual textbook resources. Questions, though, are going to be your mainstay. UWorld is going to be your main resource no matter what. So UWorld, UWorld, UWorld. And then a lot of people like the first aid for pediatrics as well, but I tend to lean towards the master the boards across the board for the peds stuff. Another resource that a lot of people find useful are the clip cases. So this is provided through a different online organization. I think it's Aquifer. But basically they have actual cases that they walk through with you in terms of a patient walks in with XYZ presentation and really helps you go through what, you know, diagnosis management and the actual clinical workup, which can be really helpful, and it goes over really every major thing that you'll need to cover in pediatrics. So a lot of good resources for peds, but not quite as consolidated as some of the others. And then must know topics, really the big things. As I was saying, it's a little bit of inpatient and outpatient. So the outpatient stuff is going to be what is normal for a 6-month-old, what is normal for an 18-month-old, really knowing what should they be able to do at every given point is essential. And knowing some of the vaccine schedules will be important as well. And then outside of that, the inpatient stuff, a lot of infectious disease in pediatrics, a lot of congenital things, and just anatomic variants will be sort of the focus of that.
Awesome, nailed it. I'll just throw in there too that incorporating an entire text like blueprints during step prep can be kind of difficult. And so again, that would be one that I would pick and choose your battles there. Find the chapters that are most difficult for you in particular and try to like grab a little bit of that to utilize rather than trying to read an entire extra text, which would be a little difficult even with the dedicated study period. You want to go ahead and talk about obstetrics next, Sana?
Yeah, absolutely. So OB is also a little bit of a challenge because it's just very different than anything that you focus on during your actual second year preclinical years. But again, relatively smaller percentage of testing on the test. So I'll take that into account. UWorld's always going to be your mainstay. Master the boards is, again, that would really be my, as you are learning my bias, that is really my text of choice for that. A lot of people do like first aid for step 2, OB specifically, but I think that in general, the master the boards is really the mainstay. One thing that is used a lot is UWIs in OBGYN. A lot of the clerkships across the country provide this to all of their medical students. So I would ask your program director or your clerkship director whether or not that's something that is available to you. But that and OB high yield is a big one. Blueprints, again, sort of exactly as Joe was saying, it is a very, very dense book. Having said that, it has absolutely everything you will ever need to know about OBGYN. So maybe during your clerkship, it makes more sense to focus on that, but less so while actually studying for the boards because it's much too dense to be able to get through during your study period. And then big things, it's really, there's a pretty significant distinction between the OB and the GYN. So really knowing labor and delivery, what goes on during labor, complications of labor, and then also knowing all of the gynecologic sort of malignancies, processes, normal puberty. So there's a little bit of both that needs bridging, but it's all sort of covered in this very, very broad topic.
Yeah, I would add on, because this is one of the areas that is slightly less represented than, say, medicine, some of that stuff is really worth diving into and paying attention to. Labor and delivery in particular is its own language. Like Sana was saying, it's not something that's really seen any other clinical rotation you have throughout the year. And so if you have this early in the year, it might be really worthwhile to dive in and focus explicitly on some of the stuff that shows up in OB that doesn't show up elsewhere, namely labor and delivery, how you would assess like fetal heart rates and that type of stuff, because you know you're going to see some questions on the exam about that. And so you know that you're kind of hitting pay dirt or high yield material when you're reviewing it, as opposed to reviewing something that you already feel strong or familiar with. And so there is some utility to focusing on things that are outside your comfort zone, even in categories that are relatively underrepresented comparatively. I'll go ahead and take a look at the psychiatry material here. Psych is definitely the smallest of the major subjects that are available. That being said, you know you're going to get some questions on mood disorder and psychotic disorders. In particular, pharmacology is like the thing for psych, and so we have to know psych meds really well. This might be an area where taking a look at like Sketchy might be useful as a supplementary resource because you know basically the only interventional management we're going to be routinely going to in psych is going to be pharmacotherapy. In addition to using UWorld, of course, first aid for psychiatry is actually the one first aid text they recommend that students use throughout the course of their clinical year. Really nice to use as a reference or to focus in on specific territories, namely like review mood disorders, review psychotic disorders. Like those are the ones that are going to show up for sure on the exam. And so knowing how to diagnose the subtle vagaries between somebody who's got cyclothymic and bipolar 2, pretty useful for the test, and something that this kind of text would help us out with a lot. In addition to that, DSM criteria are really high yield for psychiatry. They are the main format we have for providing an actual diagnosis to things. And so when they list DSM criteria in UWorld, like they literally give you a list of the things that you need for a diagnosis, you should take it seriously, and probably something you should focus on at least getting the main gist of, if not outright memorizing, in order to know this stuff really well. The other really small category that we have here is biostats. And so coming back to what we said before, biostats is pretty much the same as it was on step 1. Now, that being said, if you're like most students, you don't remember what you studied for biostats for step 1 because it's been a year and you haven't used it all year. So going back to first aid to look at like the small chapter they have on public health sciences and biostats and epidemiology is an easy way to make sure that we're looking at all of the main stuff that shows up here, which is namely stuff like study designs, calculations of relative risk, odds ratio, things of that nature. So all of the equations are still fair game on step 2 CK, and so we have to memorize them once more. And then also, UWorld has a nice little biostats module that's separate from everything else, which is predominantly utilized for step 1. But if biostats is a weak area for you, or if you're like me and you just completely forget it, like as you're working on everything else throughout the clinical year, it might be worthwhile to reemphasize and double down. It's very similar to the material that's actually in UWorld, but it does help to focus in a little bit on some of the subjects that you might otherwise end up forgetting. That being said, there's also some online med ed videos on epidemiology and biostats, and so you can go ahead and take a look at those as well if you feel like this is a real weak area. Again, it's a small category, a very small percentage of questions will be focused on this, but you know they're only going to ask you one of 10 different things. And so if you learn those 10 different things really well, you've guaranteed yourself getting a few points right on the exam, which is pretty good return for your time investment there. Anything to add on with the biostats stuff, Sana?
No, I think you really nailed it. I think the big thing is that first aid for step 1, this is the best place to use it. And I always, whenever I talk to my students, I always say these are the free points. And so they're really easy points to lose if you don't spend the time, but you spend literally 10 minutes a day just reviewing questions. It's just free points. And so they're never difficult questions. It's just remembering the equations, remembering how to use them, and the application is never hard. So really just taking the time to carve that out of your day, and don't let these be the points that you lose.
Absolutely. All right. So now that we've talked about the individual resources we'll utilize, let's talk about how we would devise a plan for studying for all this stuff. So Sana, you want to walk through like the big picture ideas that we think about first as we're putting together our study strategy?
Yeah, absolutely. So we've sort of been alluding to this as we've been going along, talking about how you think about what you're going to be using and what resources. I think the biggest things to think about when you start is, what are your weaknesses? What are your strengths? What topics do you really need to make sure you dedicate a lot of time to? What resources are you going to use? And so UWorld should be off the bat, no question. We're telling you right now, you need it. Don't think about it, just get it. And then your next resources will really be, okay, do I want to use Step Up to Medicine? Do I want to use Master the Boards? And ideally, you've taken some time before you really sit down and start studying on day 1 to sort of look at these resources and figure out which are the best for you and what's your learning style. Do you like a lot of videos? Do you want to use online med ed? Do you really like flashcards? Do you want to use Memory and Anki? So really figuring out what works best for you. And then knowing your strengths and weaknesses, and part of that will come just having done 3rd year and seeing, okay, I really didn't get a great grade on my neurology clerkship. I need to spend some time on neuro versus, what your strengths might be. So figuring that out, and then sort of organizing all of that to be like, these are the topics I need to make sure I get through. And then you have to make we are planners extraordinaire here. And so we tend to, when we work with our students, one of the things that we do is we create weekly calendars for our students. We create like, this is what you're doing on this day for this many hours, and then you're doing this, and then you're doing this. And I really think that that's the best way to hold yourself accountable. So figuring out, okay, my test date is in 4 weeks. So that means I have 28 days to do this, 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 and this. How much time do I need to spend on this? How much time do I need to spend on that? And so part of that is A, figuring out when you're taking the exam, and B, figuring out how much you have to fit. So just doing the math of how long is it going to take you to review neurology, and how long do you need to spend on each of those things. And, you know, as you go along, you find that might change. So you might think you need a whole week to spend on just, you know, strokes and brain anatomy, but you might only need 4 days. And so really adapting your schedule. And if you need more time, you need more time. So just making sure you're keeping yourself accountable and trying to be honest with yourself and checking in regularly to see how your progress is going. And I think that all of that is best sort of if you start from the beginning with like a concrete plan.
Awesome. Great way to start off our developing a study plan here. I will add on to that when it comes to doing the math, one way that's easiest for me to do the math for students I'm working with is to simply look at the number of UWorld questions that are available for a particular subject. And so say that there are 200 questions remaining in cardiovascular medicine, for instance. I know it's going to take me at least a couple days to get through that because I'm aiming to go at a pace of about 80 questions per day in UWorld. And so if I adhere to that pace, that's going to be like 2.5 days to get through a solid set of 200 questions. And so that way you can start developing a calendar where you start mathing things out in terms of how well things will fit in your study schedule. We'll talk a little bit more about that in just a second. So just to throw them out there for right now, the way we can do math with actual concrete numbers is to use UWorld, because UWorld gives us that kind of relative distribution of the material that will show up on the actual exam. One thing we want to emphasize here too is just talking about like how we can become realistic in terms of our expectations in terms of preparation here. Ideally, we want to see all of the resources, look at all the chapters, see everything top to bottom, which is why we say the ideal is you've seen all the UWorld questions once as you go through your clinical year. You're doing a second pass through all the UWorld questions again in like a 4 to 6 week dedicated study period. You see all the online meta videos, you read through all the way through Master the Boards or Step Up to Step 2 CK, and you've just seen everything. In reality, though, we can't look at absolutely everything. In some cases, we're going to have to set some things by the wayside. And so that's why we're talking about making modifications and identifying where you want to seal your gaps in terms of like doing a little bit more blueprints for OBGYN because that's your weak territory. And maybe none of the readings for pediatrics because we felt solid about that material, or focusing on Pistanas at the expense of not watching online meta videos or something along those lines. Develop a realistic schedule that you can complete on a daily basis as you're going through your dedicated study period. Don't anticipate that we can study for 14 hours every single day. It's just not manageable to do that forever. One thing we really want to emphasize is that you should set realistic limits as well. A real full dedicated study day probably is like around 10 hours of actual studying and 12 hours of sitting down in your chair, where like some of that time is lost due to inefficiencies or eating lunch or taking a break or what have you. And so if you limit yourself to that and say, what is realistic, you can develop a study schedule that you won't need to deviate from. And so you won't have that stress of needing to change your plan so frequently if we're realistic from the get-go. Along those lines, in terms of like how to set out a timeline, here would be maybe like a sample of how we might put together like a 6-week dedicated study period for somebody who's about to go in and take Step 2 CK, where we just kind of chart out, like I know that I need like 3 days to do the cardiology questions, and like I need a couple days to do GI, and I need a few days to do OBGYN, and I feel great about surgery, so I'm only going to spend a couple days and do what I can there. At some point, we have to like drop things here and there in order to make room for the other things that we want to work on. Down at the bottom here, I've kind of indicated like one thing that you can do is start saying, here are my assignments every day. I know I want to do 2 blocks of UWorld, and I'm going to do some reading and like this resource or watch some videos on online med ed, and those are my assignments. If you create a schedule that looks like this from the get-go, you can make sure that you are only going to end up focusing on one day at a time. So you can say, I know that my goal for today is 80 questions in UWorld and an hour of online med ed videos. If I do that, I'm happy. I do the same thing tomorrow, I'm happy. And if I'm happy this entire time, I'll be happy on exam day. So rather than thinking about like, in 3 weeks, how am I going to be able to fit in a UWorld self-assessment? That's way too far down the road. Instead, start thinking about, can I accomplish today's goals? So focus on the things that are immediately in your control at this moment. And that's, can I do this? Yes or no? If the answer turns out being no, which it might be, like we got to reorganize and reassess what our goals should be. But this way, we're focused on the here and now and not expanding and allowing ourselves to focus on things that we probably shouldn't be worrying about yet. Only put your anxiety into areas that you can actually directly manage. Otherwise, we're doing a lot of emotional labor for no reason. So that's my usual thesis when I work with students. Along those lines, Sana, what else can you say about like setting realistic goals for our students?
Yeah, and so this is something that we've again, been alluding to, and I talked about in the last slide that I was doing as well, is just that you have to sort of continue to reevaluate every couple of days. Say, okay, I'm going to do all of surgery in 2 days. And is that realistic? Once you get to day, halfway through day 2, are you saying, okay, I'm almost done, or do you still have a lot left to do? And do you actually have, 28 days nonstop? Are you studying every single day, 14 hours a day? Really making sure you check in with yourself. Are you actually being productive? Are you continuing to make sure that you're using all of those hours well? Do you need to spend maybe 4 hours every week just not doing anything, or a whole day every week not doing anything? And making sure that you're seeing that you have the time to do that, and B, that you're actually making the study time that you have the most effective that it is. And that sort of goes back to this quality studying too. I always tell my students, work smart, not hard. You can work for 14 hours a day, but if you're not focusing on the right things, if you keep studying the things that you already know, but it feels comfortable, it feels easy to go through the things and say, okay, I know that. I want you to spend time on the things that make you uncomfortable, because that's the only way that you're going to learn and get better. And I think that that's really, you have to be honest with yourself, and that's what will make you improve. So really checking in with yourself every couple of days and taking stock of A, your progress, B, your emotional state, and C, whether or not you're focusing on the topics you need to be focusing on.
Yeah, I really like that idea of kind of like just being honest with yourself about how well things are going. We should also zoom out and do that on a weekly basis as well. So
Yeah.
even like, on day-to-day basis, we should be saying, is this working? But then take stock after you spend a week studying and saying like, is this manageable? Like, do I have something that I can really, what I've got now, can I actually duplicate this effort for the next few weeks? If the answer is no, then adapt, change things up, move things around, change what your strategy is. One thing to point out though is that as you're like, developing your strategy and like figuring out how you can make things work, try not to get lost in focusing on one subject too much. It's tempting to kind of just focus in on like, well, I'm going to just focus on cardio till I understand it. And now it's 10 days later and I'm still working on cardio. That is not sustainable, and that's not going to allow you to accomplish your goals in a timely manner. So make sure you step away every once in a while and say like, am I going a little too far in terms of my emphasis on this particular subject? Like, was it worth it to spend 7 days straight working on OBGYN? Maybe I need to reprioritize like how I move on from difficult topics. Keep in mind, you need to see everything in order to do really, really well on the exam. And so even if you are the most knowledgeable medical student about pulmonology, it's not going to help you when they give you a psych question about haloperidol. And so we want to grab as much of the high yield information as we can. We don't necessarily want to dive too deep into the low yield stuff, because the goal is to get as many questions right as possible here. Just as we're kind of reaching the end of our webinar here, one thing I want to point out is we're going to answer your questions at the end. So if you have any questions that we haven't directly answered, please feel free to send them to us, and we'll try to answer as many as we can before we close out this evening. For now, though, I just want to say, like, stay positive. If you're stressing out a little bit over some of the stuff that we said this evening, try to look at this in the big picture and say, look, you've worked really hard to get to this point in your medical career, and now that you're here, the reason you're here is because you're thinking ahead and you're trying to establish a plan that can allow you to do the best you can on this exam. You're doing the right stuff. Now let's sort of deploy some of the strategies that we're talking about here so that we can move through with a coherent plan and nail this exam. You should be confident, because if you've reached this point where we're preparing for Step 2 CK, you've likely already completed all the core rotations and done all the shelf exams. And that means you've done Step 2 CK. You just did it piecemeal through the course of the year. Now you just got to sit down and do all those shelf exams as like a final loss amalgamated together. So if you've done the individual components, you know that you can do the full thing. Our goal here is to do the best we can on the full thing, not just to survive it, because we've already proven that you can do that. So reorient your thinking here to say like, this is something I'm going to do. Now it's only a matter of, can I do it the best I possibly can? Anything to throw in there, Sana, in terms of just like closing advice?
Yeah, I think, and again, just to reassure some of you, we're still going to make sure we get to some of the questions that you have in the chat, some of the other things. But I really think that the big things that you can do is, make sure that you spend the time to, before you start studying, I know it's really tempting to just start going, but really make sure you take the time to plan out your schedule, figure out what makes the most sense, figure out your weak points, your strengths, and just continue to remember that, you have made it this far. You're in the home stretch of finishing now. And so really it's very easy to just hunker down and get burnt out by like doing this all day, every day, but spend a little bit of time to, you know, recharge every once in a while as well.
Absolutely. While you guys are sending in your questions, I'm just going to tell you a little bit more about Med School Tutors and who we are, and then we'll answer your questions. So again, Med School Tutors is an individual one-to-one tutoring company where our tutors like Sana or myself will sit down and work with you individually over Zoom or another web application via webcam and walk through high yield material. And that usually comes down to like shelf exam preparation, step 2 CK preparation, level 2 preparation, but it also could take the form of mentoring in the terms of preparing for residency applications or like putting together a successful application through ERAS. Generally speaking, what we do with students when we work with them is we help them to, number one, tailor a study schedule with them. So we really help get in deep in terms of identifying what works best for the students we work with. We also spend time working directly over camera like this with students that we work with, the goal being to focus in on particular weaknesses that we've identified based on their previous performance and their subjective assessment of themselves. So we really like to work with direct material as well. We also communicate with our students in between sessions by answering questions over email and kind of providing direct advice towards how they should be spending their time or adapting their study schedule in between sessions. And generally speaking, we just try to help in every way we can towards whatever goal a student might have in medical school. So if there is any kind of like exam, or if your application is coming up, you want to best prepare for it, and you think that you could use a little bit of extra help from an individual like Sana or myself, please feel free to reach out to Med School Tutors. We're happy to work with you to do the best you can on these exams and for residency applications. Also point out that we're kind of adapting the way we work at Med School Tutors, and we're doing a pay-as-you-go type situation now, given like all the craziness with COVID and pandemic and changing exam dates and things like that. So if there is like a small thing that you just want to accomplish with us, you can go ahead and reach out and contact us, and we can work with you, develop the best plan possible. In addition to that, if your main goal is just to establish a really good study plan, we also do individual planning sessions with students where we just sit down, intensive, like 1 hour, 2 hour session to hammer out what you would need to do the best on your exam. So while we love to work long-term with our students, we're also establishing short-term relationships as well these days. So if there's anything we can help with, feel free to reach out to us. Our contact information is on the bottom of the screen via phone, website, and email. So let's go ahead and answer some of the questions you guys have been sending in. Sana, do you see any good ones?
I do. So one that's come up a few times and that we briefly touched on earlier was a little bit of advice specific to international medical graduates and what their plan should be as far as if that will change the amount of time they need for dedicated and if there are other recommendations. I would say honestly, I would say all the same things that we said are still applicable to international grads. I think that the only difference would be most of you, at least from my experience with international medical students, has been that they often take step 1 very close to step 2. And so my general recommendation would be there's a slight frame shift in your thinking that has to happen. I still typically tend to say if you have pure dedicated study time, if you're able to just do like, if you have no time to, if you have no commitments during that time, I think 4 weeks is generally sufficient. Having said that, it really depends on your individual circumstance. Take a practice benchmark test. If you are passing the exam, if you're in a place you're comfortable with, you could probably do it in 3. If you're not even close to what you want, you might want a little bit longer, 5 or 6. So I really think it would depend on your individual circumstance. Any additional thoughts on that, Joe?
Yeah, I would be a little bit more conservative actually and say that 6 weeks ideally would be the best amount of time, because that's the amount of time it will take to get through all the material. And so if you can survive setting aside 6 weeks of dedicated study, I would probably say that that would be the goal. It, again, depends on individual circumstances. And for someone who already feels fairly confident in their clinical knowledge, and maybe step 1 and the basic sciences weren't your favorite, but like step 2, you feel like you have a better grip on like actual clinical practice of medicine. In that case, then like 4 weeks might be survivable. But for anybody who has particular anxieties about step 2, a 6-week dedicated study period, while it might seem long at first, is actually what would be necessary to cover all the material. And so I tend to advocate for a longer study period for step 2 as it's becoming more and more important in terms of applications. Couple of things that I've seen in terms of questions are a lot of questions about stamina development and like how we would put together like, build our stamina as we're kind of studying. My biggest recommendation here is consistency. So usually what I'll suggest to students I work with is that we start doing around 80 questions per day in UWorld on a daily basis if we have dedicated study time. It might take a while to build up to that. It might be difficult to do that many at first. So that's okay if you're in that boat. I'm not saying that you need to jump in and be doing that much immediately. However, if we can consistently nail down 2 full blocks of UWorld questions with the evaluation of reading the explanations and understanding the diagrams and charts that are in them on a regular basis, if you can do that, then you can get through the entire exam. One metaphor that I like to use here, which is very tired, I know, is the marathon metaphor. To prepare for a marathon, you don't necessarily go run 26 miles every day. You usually will run far smaller amounts and then usually maybe cap out at like 12 to 16 or 18 miles. I'm not very good at marathons, but like that's, generally the intuition I have. And so the idea is that for step 2 or for step 1, you don't have to sit down and do 320 questions in a day to prove that you can survive it. Instead, get really, really good at focused 2-hour sessions of going through UWorld. So when you're really getting into like the last week of preparation, being able to sit down and do 2 back-to-back timed blocks in UWorld is going to be the kind of core unit that you're going to be preparing for on the exam. Because on the exam, you can take a break every couple of blocks, stand up, go to the restroom, grab something to drink, that kind of thing, and kind of mentally reset a little bit. If you can get those discrete 2-hour blocks down, you're set. A lot of students will try to argue that they want to do like 2 back-to-back NBME practice tests or something to simulate the exam day. Personally, I strongly recommend against that. I do not find that to be very high utility. That sounds like torture. Instead, trust that doing a half marathon or a half test by doing the 160 questions that we see like in a UWorld self-assessment will be enough to build the stamina that you need if you've been doing your daily exercises. The consistency of getting through a routine amount of UWorld questions every single day is fundamental to building your stamina. And so it's not about doing a bunch of questions one day, it's about doing a set number of questions every single day to kind of build up that individual unit of 2 hours of hardcore focus.
It's actually funny that you mentioned the marathon analogy because that is exactly what I was about to say. I think that in general, I wholeheartedly agree with everything that Joe is saying. Do not do back-to-back UWorld blocks. Or not UWorld blocks, excuse me, back-to-back NBME exams. It's completely unnecessary. It is overkill for sure. Having said that, I know that some of you will still want to do it. So I think that the big thing that I would recommend is similar to actual marathon training, exactly as Joe was saying. Sometimes what I like to tell my students is try and vary it every day. So one day do 1 block of UWorld, 2 blocks of UWorld, 3 blocks, back to 1, back to 2, and really vary it. And that will help to build your stamina as well, because that's what actual marathon runners do. That's how they train their bodies and their brains to sort of get used to variable questions. And it'll train you to not think as much when you do that 4 block test on Saturday. It'll feel like, oh, it's just an extension of what I was already doing, as opposed to a huge jump, and really just continue to vary that pace. So that's something I recommend as well.
It's actually a really good point in terms of the variation in the schedule. I like that a lot. And one thing I would say to that too is, generally speaking, the second pass, that some students asked about this a long time ago, so I apologize for not getting to this earlier. The second pass, I usually suggest students do timed blocks. If you're in a dedicated study period, timed blocks are the way to go. 2-in-a-row blocks are usually more doable if you have like 30 minutes here and there while you're on rotation during the course of the year during your first pass through UWorld. So timed blocks would be ideal. That being said, you can vary up how you review those timed blocks. You can do 2 back-to-back blocks and then review 80 questions for the rest of the day, which is tough but manageable. And you can do 1 block, review it, second block, review it. And so you can get some of that variance in there too, where maybe 1 day per week, like Sana had mentioned, you do 3 blocks, just block, 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 answer all the questions in 3 hours, and then spend the entire rest of the day reviewing all those explanations. That would be one way to kind of like build that endurance and get yourself like feeling like you can tackle hundreds of questions in one go. Any other questions that you see here, Sana?
Yeah, so there's one that I think we'll sort of wrap with this one. I think it's a really big picture topic about, didn't do well on step 1, redeeming yourself on step 2, and what do you need to get? How do you sort of best do that? And what resources you use to sort of get there. So I think that the first thing I'll say is that it is such a common thing that I hear from my students that step 1 didn't go as I had hoped for a variety of factors, whether that be, personal, not really having the right resources, etc. And I think that programs really care, and Joe alluded to this before as well, is that programs really, it means a lot to see progress. So if you like barely scoot by, if you get a I don't even know if it's 192 anymore. Is it 196 on step 1? If you
it's 194.
194, right around there. So if you get a 194 on step one, even if you have a delta from that, that is huge. And that is an extreme asset to all of the programs that you're looking for. And I think that certainly it's important and helpful for you to do well on step two. As for how to do that, I think the biggest thing is identifying what didn't work on step one. Was it simply a matter of, being able to focus on your actual weaknesses? Was it particular topics? Was it like obstetrics and gynecology specifically? Was it more basic foundational concepts? Was it more those second order questions? And identifying those things, and that takes time, and really taking some time to go through how your brain works to figure out, and doing practice questions with other people sometimes, and then really making sure you reconstruct your study schedule to see that growth, and using these resources really, as we're mentioning, for perhaps a longer period of time than some of your peers may be using them. But I think that that's really you definitely can do better, and it definitely will be a huge asset to you in residency applications to do better. And I think that the big thing is just resources, and figuring out what works for you and what your learning style is.
Awesome answer. I think on that note, we will be closing out for this evening. Sana, any last things to say before we close out for this evening?
No, I think just thank you all for joining us. And, we really appreciate any feedback you have, and that'll help us to sort of build future content for you in the future.
Yeah, thank you everybody so much for showing up this evening. We really appreciate all the questions and feedback you guys were sending during the session. It really helps us to kind of get an idea of what works best for you guys. So really appreciate you guys being a great audience. We wish you the best of luck on your exams and your applications in the coming cycle. Good luck out there, and we'll see you on the wards.